Being diagnosed with mesothelioma or having a loved one diagnosed can be an extremely difficult and stressful time for patients and families. Here are some of the key ways that friends, family members, and caregivers can best provide compassionate support. One of the most important things is to listen without judgment. A mesothelioma diagnosis often comes as a complete shock, and patients may experience a wide range of emotions including fear, sadness, anger, and disbelief. Give them space to express how they are feeling without trying to minimize their concerns or provide unsolicited reassurance. Let them vent frustrations or fears without feeling like they need to stay positive. Active listening through attentive silence or acknowledging comments with small responses like ah or head nods can be very comforting. Educate yourselves about the disease and available treatments. Having general knowledge about mesothelioma allows you to better understand what the patient is going through from a medical perspective. It also enables informed discussions about options and expectations. However, be careful not to give medical advice or act like an expert. Emphasize your learning together. Credible websites like the American Cancer Society or National Cancer Institute have detailed disease overviews. Ask doctors to explain things in understandable layman's terms as well. Offer tangible assistance with daily tasks and self-care. Follow the patient's lead on what they specifically need help with as strength and energy levels fluctuate. This can involve things like meal preparation, childcare, elder care, transportation to appointments, light housework, paperwork, or bill management. Make it clear they just need to ask. Staying physically active is important, so help with short walks if approved by doctors. Make sure basic comfort needs are consistently met like having nutritious food and drinks available, warm blankets, assistive devices, etc. Provide opportunities for distraction and enjoyment. Isolating oneself and symptoms and fears can worsen the emotional toll. Suggest inclusive activities the patient is able to enjoy from home, whether that's watching a funny show together, virtual game nights with friends, light video chatting, reading aloud, doing a jigsaw puzzle, looking at old photos as a memory break. Have the supplies for those readily available for when they want a mental break from treatment focus. Advocate for the patient's needs and wants. Medical conditions are stressful enough, don't add unnecessary stress by keeping the patient in the role of having to repeatedly ask for things from doctors, the healthcare team or insurance. Accompany them to appointments willing to ask questions they may forget, take detailed notes, clarify directions, repeat back plan next steps. Proactively follow up on requested referrals, tests or paperwork approvals. Address any financial issues by getting estimates, applying for programs or coordinating fundraising if needed to minimize money worries. Share happy memories and inside jokes. Laughter really is the best medicine. Go through old photos, letters or mementos reminiscing about favorite past trips, childhood hijinks, funny workplace stories, inside jokes with family, friends. Record video messages from people who can't visit for the patient to enjoy later. Compiling these meaningful keepsakes into a book, scrapbook or digital photo album preserves bonds and provides comfort when they may feel too unwell for visitors. Respect privacy but be nearby for comfort. Give the patient space when they indicate wanting to rest or have quiet time alone. But also make your consistent availability and readiness to help with anything very clear. Leave touches of comfort like lotions, soft blankets, tissues, reading materials or favorite snacks within easy reach. Having another person nearby just sitting quietly can itself be soothing company without pressure to converse. Visit or call regularly as a loving, familiar presence. Support extended family needs too. A mesothelioma diagnosis affects the entire family unit, so make efforts to check in individually with different relatives. Siblings may want distraction activities with kids to temporarily escape stressful home situations. Parents could use breaks for errands or rest so they don't become physically or emotionally drained caregivers. Spouses will need empathy as they manage added responsibilities and watch a partner's health decline, which is extraordinarily difficult. Offer household help, prepared meals, transportation aid so they have solid support networks as well. Connect patients with emotional support resources. Learning coping skills during treatment is important for quality of life. Recommend support groups in person or online where patients can connect with others directly experiencing a similar journey. Counseling, grief therapy, or pastoral care may help process fears and find meaning. Pet therapy, meditation apps, inspirational readers can offer calming outlets. Music therapy is also used for some mesothelioma patients. Make sure individuals recognize it's normal and okay to access psychosocial support when needed. Honor patient wants after treatment ends. Have meaningful conversations about end-of-life preferences for care, memorial arrangements, facilitating closure conversations if desired. Carry out a legacy project wish like publishing a collection of advice, life lessons to pass on. After someone passes, continue supporting the family through the grieving process with meals, comfort, activities, shoulders to cry on, understanding they may experience waves of sadness later on. Commemorate milestones and anniversaries with light-hearted memories together to celebrate a life well lived. With compassionate care and support like this from a strong community, mesothelioma patients and families can experience the best quality of life possible through even the most difficult stages of illness. Small comforts make a tremendous difference. The goal is ensuring no one feels alone in facing the physical and emotional burdens of this disease. With open communication and teamwork, loved ones get through it together as comfortably as possible.